Good evening, ladies and gentlemen. My name is Ziad Abdelnour. I'm President and CEO of Blackhawk Partners, and I'm the founder and chairman of the Financial Policy Council. Why are we here? Why the hell are we here? Just to have a nice event, social event, drinks and food? No. This is not a social club. This is not to wine and dine. This is here a group of committed activists, conservative activists, who are sick and tired of this system out there and who want to change the order of things. If you're not like that, you can leave this room. Very simple. We're not here to chit-chat and to talk theory. We are here to make a difference. I spent 12 years of my life doing that already, building the Financial Policy Council. We have a great board. We have a great Project Liberty team. And those who are in joint forces are more than welcome. I am shocked by some of the people today who are taking it so nonchalantly. Biden is raping everything. The Congress doesn't know what the hell they're doing. The policies are all upside down. Immigration, illegal immigration, taxes, regulation, you name it. Everything that should be done is not done. Everything Trump did, they undid it. Everything that capitalism stands for, they're killing it. They're killing the golden goose. We're going to soon be a third world country or banana republic at the rate we're going, and they love it. And they have all the right to be extremist as Marxist, and if you push back, they called you a right-wing fascist. Look who's a fascist. I mean, wake the fuck up and see what's happening. Stop being bamboozled by these people. Put your mask, scare tactics, stay at home, don't do this, don't do that, obey. Stop this all bullshit. You have to rebel. Yes, I'm for rebellion. You know, what's taken by force, only you take it back by force. There's no diplomacy. When Hitler ruled in Second World War, Naval Chamberlain wanted to be diplomatic about it. And look what happened, nothing. Unless came Churchill and said, we're not taking this shit from no one, and he won. Sometimes you have to rebel, you have to push back. I'm not saying to go and kill anyone, just go and be positive, push back, write, do something. Stop looking as an observer to things around. Capitalism is under siege, your well-being is under siege, your family is under siege, everybody's scared, and nobody's doing nothing. The Financial Policy Council is the catalyst for change. There's no nonprofit conservative organization who has the balls we have and who do things the way we do them. They all write blogs. It's all written by academics and professors and all this bullshit. We're not professors or academics. We are business people, wealth creators, activists, who want to make a difference. That's a big difference between a professor writing for academia in a nonprofit and a business activist who wants to make changes. And this is what we stand for. And if you haven't joined the council already to make a difference, there's something wrong in your head, honestly. What are you waiting for? You know, what are you waiting for? Is the force, is the unity. really what I want, what my goal is, what our goal and the board of the Financial Policy Council, the project ability, is to create an army of millionaires and billionaires and people who have balls and can make a difference, including women who can make a difference. Because once you do that, you're unstoppable. You're lethal. Nobody wants to mess with you. Once you have 1,000 people like this, that's a force. That's power. You want to make a difference, you have to exert power. And you know, it can be very subtle. My father always used to tell me, power does not roar. It's silent. You can exert as much power as you want by being silent, not by begging, you know, I want to do this, I want to do that. Use emotions. Don't use emotions. Emotions is for the weak. It's for the guys who are not equipped. Be smart about it. Use your brain, connect with the right people, do the right things. Nobody has to know what you're doing, but just do it. This is a rude awakening. Please, 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 wake the fuck up. I don't care if people get offended by my language. I don't care. This is not about style. This is about substance. Do you get what I'm saying or not? Does it go under your skin or not? Does it make a difference or not? This is what we're here for. To empower each other, to help each other, to work towards the same goal. Not only for the benefit of the country, but for our own benefit too. So, I don't want to do a long speech, but to summarize, we are here at the Financial Policy Council to find solutions. Nobody today is finding solutions. It's all about problems. It's all about divisiveness, hatred. I hate Biden, I hate Trump, I hate this, I hate that. No opinions. Nobody's on solutions. I remember 10, 15 years ago when I used to watch TV, I used to listen to intellectuals, capitalistic intellectuals, like Milton Friedman, Fred Hayek, who talked about capitalism in a very smart way, posed way. This is what it is. This is the advantage, this is the advantage, this is it. People learn. Today, there is nobody who's talking about, there's no intellectual discourse. It's all anchors on the left or on the right, divisiveness, and always relating events. No more thinking, no more critique, no more critical thinking. And when a nation loses that, they lose everything. There's nothing left. You have a nation of morons running the show. And everybody is becoming even more dumbfounded because there are even more morons. So we like to find solutions to every asset class out there. We have specialists, resident experts in oil and gas, private equity, real estate, blockchain, Web3, healthcare, everything. And every event we do, we like to take one asset class, bring in the experts, and go over a very smart reasoning, thinking about how to resolve the problems in that asset class. So I'm going to go and ask our distinguished panelists here a few questions. Then I'll leave it up to you to ask them the questions you want. We're very interactive here. Unlike most nonprofit where you have the keynote speaker who pontificates and asks questions, and then the audience is sitting like this, it's like slam dunks, looking at him. No, this is not the model we follow. We have a very interactive discussion. I want you to be very involved in the process. If not, why are we having this? To go and have some drinks? So today, the issue is about healthcare. We brought 3 experts, and most of the people we bring are people in the trenches. If we're talking real estate, we bring in 3 real estate experts, healthcare doctors, so they know what the hell they're talking about. It's not a bunch of academics and theoreticians talking about healthcare, because they know shit about healthcare. These guys have spent their lives in healthcare. So you hear it from the horse's mouth, and they have the, and they will say it to you. The plain truth. That's what's happening. Then it's up to you to decide what to do. I'd like to leave it to the speakers here. If each one of them can give us some background about who they are, then we can start. Omar Hamadi.
Good evening. So I'm Omar Hamada from Nashville, Tennessee. Used to live up here in New York. I'm a physician, board certified in OBGYN, family medicine, and eligible in sports medicine, also with flight and aerospace and deep sea and hyperbarics from the special operations side of the military. And glad to be here and look forward to kicking it off. So, Jeanette.
My name is Jeanette Skinner. I am a registered nurse and I am a fellow of the American College of Healthcare Executives. I have been a hospital and health system CEO for 2 decades. Have extensive background working in multiple platforms, whether it's physicians on the insurance side or on the hospital side. I also am a senior board member for 2 healthcare AI companies, and as an expert consultant to industry, I work with several organizations on financial turnarounds, revenue cycle management, claims adjudication, et cetera. So have a lifetime, like my colleagues, dedicated to the service of others through healthcare.
I can't believe I have to introduce myself after Omar Hamada. I like to say I used to be a real doctor, and then 20 years ago I committed myself to face, breast, and body cosmetic surgery, and that's what I've done pretty much exclusively. But then made a about turn with my interest in therapeutic medicine as I saw some of the new tissue technologies which were coming about, and recognized them as clearly being the most dramatic medical intervention since antibiotics. So we're going to talk about we're going to talk about the difference between pre and post antibiotics and pre and post regenerative medicine a lot tonight.
First question is, the United States continues to lead the world in scientific discovery, technological innovation, and healthcare expenditure. Why then do we continue to fall in the rankings of lifespan, infant mortality, preventative death, and general health rankings? Is it possible? Can we reverse the trend? Any one of you can start.
Okay, I'll take that. Yeah, I'll start. So we do have some of the greatest science in the world and some of the greatest scientists in the world, and come up with many of the leading technologies and information. But our system is not only very inefficient, it's fractured and broken, and and results in a decreasing lifespan. Over the past 5 years, the lifespan has significantly fallen by probably about 5%, whereas for the past several decades, it has only continued to increase. And I think the issue...
What's the lifespan today?
Today, it's about 75 years. And I think it's multifactorial. One, I think that we have transitioned from a physician-patient relationship to one where third parties have interjected themselves between physicians and patients for a for-profit motive, where now physicians have actually become commodities instead of professionals, and patients have become people that this service is sold to. And I want to differentiate the difference between medicine and healthcare. Medicine is the message of hope and healing that we all seek when we're ill. And healthcare is the business that seeks to increase stock price. And there's nothing wrong with that, but it becomes an issue when we're talking about somebody's health. There are other issues societally. I think we're getting to be a less healthy society because of processed foods, increased carbohydrates, increased steroids and antibiotics in our foods, and additives. We've gone from an average weight in the 50s for Army recruits from about 150 pounds to now I think the average weight for a male is about 210. Some of that is muscle mass, but a lot of it is also fat mass. I'm not too worried about weight, or what I'm worried about is body composition. So, I think that's the main issue. And then other reasons, because the system is so overwhelmed and so overloaded, there's very little time to actually deliver proper healthcare. So people get shoved in and out like cattle, and we're not solving problems. We're not reversing chronic disease. We're managing chronic disease, and it's getting worse and worse. And that's one of the things that I'm promoting with the way I'm approaching medicine now is we need to figure out where a person is on the disease spectrum, interrupt the disease process and before the diagnosis, and see if we can't increase longevity, increase lifespan without meds, so people can be actually healthier and also optimize human performance.
So how can we reverse the trend, and how long will it take?
I think we'll just go in order here.
We need solutions.
So we know it's bad, right? We know that we spend double what some of the wealthiest countries spend on healthcare. We know that in the United States, our healthcare spend broaches 20% of our total gross domestic product annually, and yet our outcomes are poor. So the solutions really are quite simple, believe it or not, and there's eloquence and simplicity, but it's hard to get to. One of the biggest drivers of ineffective healthcare starts with what breaks down in the hospital, where you have 25 to 30% of the time that your nurses, doctors, and healthcare team, you would think, are there to look at you as the individual patient in your current state, where you are on the paradigm. What we're seeing is that 25 to 30% is spent on the fourth bureaucratic state, the fourth branch of government, which is all of the three-letter acronym obligatory government entities, whether it's CDC, NIH, whether it's all these regulatory bodies, have created so much complexity into the system that our healthcare members spend more time trying to chart to not get sued, not get penalized, maybe hopefully get paid, that's time away from the bedside. It's a huge, huge problem. So one of the solutions is to streamline how we're administering the just unbelievable bureaucratic burden that has been placed on physicians and healthcare providers that takes them away from the bedside. The other issue is that funding is a real crisis, and that funding, having run hospitals, I can tell you, directly contributes to poor outcomes. 40% of patients in a hospital setting will likely have some type of untoward event, whether it's a medication reaction that was a known complication. We're not talking about an error here. These are known complications or known complications of surgery. What could we do if we had more funds to invest to be able to make sure that all of our surgical equipment is working, to make sure that the scopes are clean, to make sure that the staff is well trained, and that maybe we would have invested in wellness to the point where patients aren't having to take bags full of medications. As medications have increased in this golden era, we're seeing now a smaller gap of time between a therapeutic dose and what could be a very dangerous dose of medicine. And with obesity and the lifestyle problems, we're seeing that patients cannot process the medications the same way, and as a result of that, have these complications. So I would say using our technology and our advances in medicine starting at the front end of the lifespan, get people a little bit healthier. To your point, we have a lot of contaminants in our food and our environment. Once you're in the hospital, let's reduce that burden from the healthcare providers using AI, using digital health, and these investments so that they can focus on the individual patient. And I have to tell you, there's another big piece of this. The industry itself has many of the cures we believe that are there, but there is a lot of gameplay in terms of patents and preventing certain things from coming to market that makes it difficult for us to heal things that are available in other countries all around us, and you're seeing the outcomes with better life expectancy, better health and healing.
Can I take that, Greg, before passing on to you? One of the things I think, one of the solutions is going to be individualized, personalized medical care. And I think people have been fooled into believing, not necessarily fooled, but convinced into believing that your healthcare really isn't in your hand. It's really whatever's done to you, your genetics, the environment, what physicians give you, et cetera. But what we know now is 50% of our healthcare, 50% of our health is really based on the decisions we each personally make every single day, what we eat, how we sleep, how we exercise, what we drink, et cetera. 20% is based on the environment, environmental toxins. 20% is based on genetics. And some of those genetics are modifiable. There are some genes that turn on and off like a light switch based on the decisions we make. For example, certain cancer genes that turn on in high carbohydrate states, high insulin states, obesity states. Obesity is a huge risk factor for not only cardiovascular disease and stroke and hypertension and renal disease, but also different types of cancer. And only 10% of our health is really based on what the system or physicians do, and most of that is surgical, whatever we can cut out. Otherwise, we're managing chronic disease, and you're getting sicker and sicker with more and more pills and fading away. Would you rather fade away in a nursing home bed for 20 or 30 years with bed sores and 50 pills a day, or would you rather live to 110 and be healthy the day before you die and then just drop dead?
Very interesting, Omar, very informative. Dr. Lawrence.
The bottom line is you guys are getting fake medicine. There's a website called NNT, number needed to treat, as a medical term. You would be fascinated to look at what your sister or your mom has been recommended as having a treatment. Look it up, see what the data says. And no matter the reason why a doctor went to medical school, he's been conditioned by the system to feed the man, not take care of you. So you're all getting fake medicine unless you really go to a physician who's outside of the system. What you're getting is nothing like what you would get in my clinic. You have stable chest pain. You're going to see a guy that goes to the ER. You're going to go to the ER, and there's going to be a really, really good chance with chest pain you're going to get a stent in your coronary. We know the data on that. For people that are in a stable situation, the stents do not help them. But it makes everybody feel better, and it feeds the man. So you guys are going to understand after talking with Omar's just amazing with understanding all the little things that have worked in the past that doctors have turned their head to and no longer give attention to, even though it's been proven. We know how to keep people healthy. And for the people that don't want to be healthy, one of the things that we need to say with this council is die. You know, the system doesn't need to take care of people who don't take care of themselves. And the deal that you get by being born into society isn't for you to make bad decision after bad decision and have money comes out of the kids' wallets and their future.
Brilliant, brilliant. Thank you, Dr. Lawrence. All right, let me ask you, why does it become more and more dangerous to be a hospitalized patient year after year? I mean, what can be done about this? I mean, I hear this all the time. People who go to the hospital go there to die. Don't go to the hospital. Avoid the hospital altogether. All these people put on ventilator and all that bullshit. They died. I have personal friends who died because of that. And they were pretty healthy and young people in their 40s and 50s.
Mm-hmm. So we have some of the best medical science knowledge and technology in the world. And physicians and nurses as a whole mean well and to do the best for you. But I want to tell you a personal story real quick, because not only am I a physician, but I was a patient at one point. And right now, the last place I want to be as a physician is in a hospital as a patient, because it scares me to death. Not only are people who are untrained taking care of physicians taking care of patients unsupervised, but physicians and people are focused on computer screens and laboratory values and imaging tests, and we've forgotten about the patient. Several years ago, I had an untoward event. I had a colon rupture, got septic. I was in the hospital. I knew it was happening to me. I was getting septic, and I would be dead within an hour, I thought, if I didn't get IV fluids. I called the nurse. I was in good physical shape. She looked at my vital signs and said, don't worry about it. Your vital signs are stable. You're okay. And I was like, I'm not okay. I'd lost all feeling from mid-arm down and mid-thigh down because my body was shunning blood to the core so it could support my blood pressure. I was having rigors. We study about rigors in medical school, but I'd never seen rigors. It's like having a grand mal seizure, but you're still conscious and able to function. But I couldn't, the whole bed was shaking because my body was collapsing. But she was like, your vital signs are fine. You're okay. I said, call the doctor in. So I was hoping he would recognize this. Recent residency grad, not board certified yet. He came in, said the same thing. I think they talked out in the hall. Said the same thing. You're okay. Your vitals are fine. You're okay. And he said, I said, I need fluids. And he said, I'll check you back in an hour. I said, I'll be dead in an hour. I need fluids now. He's like, I'll check you back in an hour. I had a friend text one of my primary care doctor, who is a 70-year-old doc, old-timey guy like Marcus Welby, MD. He takes care of the governors in Tennessee and the U.S. senators there. I mean, he's well respected. He was at my bedside in 4 minutes, took one look at me and said, "Look at me. I believe you. You're going to the ICU." He saved my life. But as a physician, they weren't even listening to me, and I knew it was happening with my body. And there were those kinds of errors. What if if you have no healthcare experience? You don't have an advocate. You don't know what's going on. You're at the mercy of those taking care of you. And they mean well, but hospitals are dangerous places to be.
It's scary, scary.
Being in healthcare and running hospitals my whole life, I can assure you that every one of my family members has been in my hospitals with me literally. I happen to have a family member in the audience, they can tell you, literally with mom, the CEO, in the room with the patient. In August of last year, my husband of 35 years went down with a very massive heart attack, unanticipated, very healthy guy. And of course, I was with him every step of the way, and I had to yell and shock at the ER physician, the ER nurses, to get them to do the right thing. There's very precise time limits to save cardiac tissue. Why is the distraction in healthcare, why is it the way it is? To your point, slave monitors are placed up and they're more worried about checking the box, did we talk to you about smoking cessation and did we give you your flu shot, and now it's the COVID vaccine, than they are taking care of the patient in the bed. Now, it sounds bad, but the reality is, I think the system breaking is exactly what needs to happen, because we're getting ready to enter, I think, this new dawn of healthcare where we're going to be able to streamline and reduce the burden that is distracting people from the care that needs to be provided. To your point, most doctors and nurses like myself and others want to do a good job. The system that was brought to us, our friends in the government have made it so that you can't safely do your job. It's really, really time to say, stop, let's go back here. This is not working. And people are dying. And not only are people dying, but they're also spending the money for the next generations. We know that our Medicare Hospital Trust Fund is essentially bankrupt. We know that by 2030, significant unfunded liabilities, not just Medicare, but Social Security, veterans pensions, the funding is simply not there. We started seeing that already this year, for the first year when there were major draconian cuts to what was covered. We can no longer afford to provide bad care that's ineffective. So I think what you'll hear today from our panel is that there are different solutions, whether it's AI technology, whether it's regenerative medicine, whether it's a more individualized care. There's a better way to do things that will make it safer. But right now, I'm sad to say it's not. It's probably the most dangerous that it's ever been.
Thank you. Omar, that's a dramatic story. Thanks for telling that. Fascinating. Story tells so much. I had an accident one time. I won't tell you what I was treating the patient for in my specialty clinic, but I had a patient that came to me at 1 year follow-up and said, Dr. Lawrence, do you remember treating me? Of course I did, and he'd had a good outcome. He said, I want to tell you something else that happened to me. I didn't give you my full medical history because I wasn't sure you would put me under the knife. And so I want to tell you that story now. I said, what's that story? He said, I'm 64 years old. When I was 14 years old, I was diagnosed with severe asthma, and I've been admitted to the ICU 60 times over the last 40 years. That doesn't count the number of times I had to go to the emergency room and I avoided the ICU. You did the cellular procedure on me, and within 3 weeks, I completely stopped wheezing. I stopped all 5 of my medications, and I haven't wheezed since. These are the type of interventions that we currently have, and the reasons you guys would completely understand that there are barriers for us to be able to take that wider scale to patients, but that's the world that we live in. We in the council are looking for solutions, and I believe that the technology that I was able to be used will be taking away from us. What we can currently do in an office setting and in a hospital setting even, we will lose if we don't stand up to the tyranny. And so I've already made arrangements to have an international footprint because I will be compliant with the way the rules are, and if the rules change against us, we're going to find a way to take care of patients. If they don't, then there will be a lot of losers. And it's up to people like us in the council to make sure that we advocate for our patients in the ways that we can.
Thank you. So, I mean, look, I mean, these are great ideas, great solutions. How do you make them happen? How do you make people aware of that? A lot of the people are not aware of this stuff. They go, they know they get sick, no preventive medicine, no nothing. They go to the hospital, they get screwed there, they die there. I mean, how do you change the name of the game? How do you really inform them? This is it. I mean, the practitioners, the entrepreneurs, all these people, doctors, they're not doing any marketing on that. I never heard about that until I hear about you. And I'm very well informed, believe me. And I never heard about that stuff. How do you make this happen? How do you transform from the old traditional hospital public treatment to a privatized special care, you know?
So there's two suggestions I can have. Number one is what Omar said. He had to call on his cell phone a private doctor. You've got to have a relationship with somebody who adheres to Hippocratic medicine. I mean, we've now been so coercive in medicine. Everything is coercive. This is a relationship. People can deny treatment. They deserve to know about risks, benefits, and alternatives. They should be able to understand, even if it's delegated to a nurse, they need to be able to understand that. Patients nowadays don't. So if you have a private physician who's not conflicted by an insurance company, you will probably get a type of care that'll be at the level that you want. And the other thing too is there are some companies, small pharma, which is really, really moving regenerative medicine in the right direction. Ziad, in 2016, the Congress actually told the FDA, we believe in moonshots, we want cures to happen. And of course, they created an expedited pathway. And to this point, there have been 150 companies that have been denied that expedited pathway. There have been 80 companies that have been approved for expedited, basically moonshots, and not a single one of those has been approved. There are actually 10 companies that are operating in stealth mode, meaning for some reason, they're not making public what the 2016 Congress mandated for the FDA to do. So if you have a private doctor and you keep your eye on the ball, we do have technology that's coming that may be available, at least in kind of small doses. But then we've also got concierge medicine, whether it's medical tourism or available in the US, there are solutions, and there's big solutions.
I want to take a little different approach. I'm going to put the CEO hat on here, the doctor.
Please do.
And I'm going to say to everybody in this room, and I said it earlier today, there's this little thing called our First Amendment rights. And we allowed those to be taken from us when we had things to say in healthcare. We've seen physicians potentially lose their license. We've seen people be censored when they had things to say that now, 2 years later, are coming out to be true. And so I think the one thing that everybody in this room can do is use your voice professionally, appropriately, use good data to back up what you're saying and make sure it's reliable data. But the politeness that we've had in healthcare, we're very polite people. We have a tremendous amount of gravitas and respect for every person that comes our way. We've allowed our voice to go silent, and we can no longer, because the next patient in the bed is Omar, is me, is Greg here. And the next patient in the bed is you and your family members. This is not just about the COVID vaccine or what happened during COVID. COVID kind of exposed all of that. But there's so many other types of treatments, whether it's stem cell, whether it's regenerative medicine. There's many different therapeutic agents that have been out and used, old, very tried and true medications that are being blocked. So I think, how do we begin? We begin by getting a little courage, saying what needs to be said, and said enough. We can no longer afford to do things the same way. So I'd say go back to the book. We have a good guidebook. It's called the U.S. Constitution, and start with your freedom of speech.
Brilliant. Thank you, Jeanette. Omar.
And people are waking up. In every social strata, they're waking up. I think the internet is a tremendous resource, and it can be used for good or for bad. I mean, we all get frustrated when a patient comes in and says, well, I saw this on Google. I'm like, oh heavens, Google MD. But at the same time, we can do so much research, and I think education is the answer to waking people up. People are getting less and less trustful of the government, of healthcare, of physicians, of the entire system. How do we solve it? I think people like Elon Musk are giving us a great example, and it's through the power of economics, just like what you're building. But yet the government, look what they're doing with him. I mean, he's taken over the space race. I mean, he's eclipsed NASA. Not only that, but he's developed EVs that everybody, is talking about electronic vehicles now, and he's got the most successful organization. And not just that, not just SpaceX and Tesla, but I mean, he's doing so many other things. But what's the government doing? They're suing him because he's following the law by not hiring illegal migrants. Because now they're just looking for a way to silence him because he's speaking up and saying things they don't want to hear. Just like many physicians did, like you were saying, and not just do they silence us and threaten to take our licensure away and threaten to take our board certification away, they've imprisoned a few physicians for going against because of misinformation. So how do we change it? We speak up. They use fear to really control us. I mean, fear controls all of us in whatever way. We have to overcome that. So we need to speak up. We need to have group strength. We need to have economic strength, because I think that's the answer, because people are hungry for it. They want to hear it. And they will hear it, and they will respond, and they will change if we can get over our internal fear that is initiated by others.
Thank you, Omar. That's exactly what we're trying to do year after year at the Financial Policy Council. In our own way, step by step. Okay, let's talk about AI. You mentioned this a number of times, Jeanette. I mean, how do you see the recent advances, the recent dramatic advances in AI and tech impacting the healthcare sector moving forward?
I'll start off on this one. I happen to be a board member for 2 AI companies. Yeah. And, first and foremost, it's here. It is tremendously powerful. I think that, to give you an example, the particular AI I'm working with allows us to take an ultrasound image and in about 17 seconds can precisely tell you a predicted delivery date of a baby, which means that if we know a baby's going to come preterm, we can then intervene faster. That's a great example.
Will it tell you the gender too?
We can tell you the delivery date. The picture will tell you the gender. I can tell you what to look for.
I got you. Okay.
They do the hard part.
We do the hard part. But what's interesting is it tells you is there a risk. So AI has the ability to scour on the financial side, the records in the hospital, make sure you got paid properly, which is crucial to sustainability. But on the clinical side, has pattern recognition that's extraordinarily precise. And the AI is learning and finding new things that we never knew before. So for example, in women's health, for the last 20 years, the greatest predictor towards preterm birth was, do you have a history of preterm birth, which does not apply to first-time moms. Or they were looking at just one clinical metric, a cervical length. Well, we now know that there's 8 or more anatomical areas that are highly correlating with that preterm birth. So it's precision medicine. In a few seconds, we're able to glean more information. We're seeing AI right now. CMS has just issued codes for AI use in retinal scans, blindness. We're also seeing it heavily used in cardiology. For the ladies in the room, we use AI with our mammograms every year to detect cancer. They'll send the mammogram right to the machine. So the benefit is that you get to diagnose that there's a problem earlier. You get to intervene earlier. You also get to re-monitor very quickly at a very low cost, and you can determine if this is effective. This is a very important statement because AI is the great leveler. We're no longer going to allow bad medications from bad pharmaceutical companies continue. We're not going to allow bad medicine to continue. The AI is agnostic to all of that. It looks at pure data. It looks at pure anatomy. So I think it's really wonderful. The watch-outs are, make sure with these companies as you're looking at them, did they build their AI with a substantive enough database of data? Has it been validated across diverse populations? If it's, were you allowing it to train independently and learn across Asians, African Americans, Hispanics, Latinos, Italians, whatever? You want to make sure you have a huge population. And you want to make sure that there was not unnecessary tinkering with the formulas, but rather the AI has been allowed to grow itself and see what it sees without interference by people that might have an agenda. You know, if any item can be weaponized if it's made improperly, if the people have the wrong mindset, I would say. So it's tremendously powerful to see that in a matter of seconds, you can now see what the human eye could never see. It's very powerful. It will never replace the physicians. This is just information like a lab result for them to react to. They still have to individualize the care.
If I can make a comment about AI, for all those radiologists that should be out of a job because of AI is so much better than they are, right? Yeah. On a bad day, it's better. They need to either go to Nashville. Omar's specialty is basically taking all the little things that we proved over so many years that work, putting them all together in a way, and basically he's doing regenerative medicine that foresees humans being able to live decades longer. So that's what the radiologists need to do, or they need to come to my shop where Kevin, if you'll stand up and put your hand up. Kevin's part of a $3 billion vertical called biobanking, and that space is going to double over the next 3 years to $6 billion worldwide, most of it here in North America. And he will bank your own cells so that you basically have your private medicine chest ready to do really extraordinary things. And I want to invite pharma to fight their way through the FDA, and we're going to support them. But when pharma doesn't come through for our patients, Kevin's biobank and a good physician is going to be able to do things that are extraordinary.
Thank you.
AI is amazing, but like you, I'm concerned because already we see DEI sort of injecting itself into it. I mean, when you look at ChatGPT and ask it a question, we can tell exactly where it's coming from. And the other issue is, I mean, it's all based on who's programming it, but what we've seen even in medicine before AI is that there are racial differences in physiology. For example, kidney function and how certain drugs react in certain people's bodies. But yet they're trying to erase all that and make it all ubiquitous, or just all general, but it's actually damaging patients, and they're doing it for political reasons. So we need to watch that, I think. On the other hand, we've talked about a lot of negative stuff. Let's talk about some positive stuff. There's tremendous hope. We live in the best time to live in history. There's so much opportunity. There's so much incredible technology. There's so much knowledge that we've never had before, and it's doubling every 3 or 5 years now. We live in the greatest time for opportunity, both financially as well as health, in terms of increasing our lifespan. So despite all you're hearing, we have a very broken healthcare system. But we have so much opportunity on the other end to do things that we have never even dreamed about before. And actually, if I may, real quick, there's someone else in the audience, Dr. Leah Houston, who's an emergency physician, who's developed a startup that affects some of this. Leah, would you tell us just a little bit about it?
Yeah, thank you so much. I was lucky to be invited by Dr. Hamada and Dr. Lawrence today. I'm an emergency physician, and everything that every single person is talking about today, we're really talking about personalized medicine, and we're talking about patients being able to find the right doctor, and that doctor being able to do what they want to do and what they're meant to do, and following the Hippocratic Oath. And unfortunately, we as physicians have become tethered to this system, this insurance model, this private equity-backed, vertically integrated health system model where we're essentially pawns. And they use protocols to guide us on how they want us to behave. Doctors are losing their license for telling the truth. A lot of them are afraid. They're afraid to speak their mind, and there's no way for us to communicate and coordinate care amongst each other. And so we've developed a decentralized identity technology that allows physicians to plug into each other and coordinate care amongst each other. We can essentially automate workforce mobility for the physician community and allow them to, essentially create a referral engine amongst themselves, unplugged from the insurance company, unplugged from vertically integrated systems. And, all these amazing things that you have, talking about ultrasound and AI, talking about stem cells. How do you know that your doctor will know about that if we as physicians are not communicating about these new up-and-coming things? We are in this information age, and we need a way to rapidly communicate uncensored. And we actually have a revenue generating model around our credentials and our identity. So this isn't just a gimmick to allow doctors to talk. This is allowing us to work and move freely so that we can serve you. And it's called HPEC. So it is one thing. I got my certification at MIT for AI as well, because automation is the future. We need to essentially own our patient relationships again. That's what we're going to do.
Thank you, Liam. Great. Okay, I have one more question for you guys, and I'll leave it up to the audience to ask you their respective questions. So the presidential elections are around the corner. What advice would you give the next president to fix our nation's healthcare sector? Be brief.
I'll start, and I'll hand it left and right. I would start with not giving the advice to the president, because if you think a presidential election is going to save you, you're wrong.
Okay, so who would you give advice to?
We need to save
get things
ourselves.
done?
The industry needs to save itself. We need to do what we're doing right here at the Financial Policy Council. We need to do what we're doing in our respective places, communicate with each other, and not be silenced when we can bring better care that's more cost effective, that's better outcomes to the future.
Okay, listen, we can write as many white papers as possible. Who do you disseminate this information to? Who are the power brokers who are going to make this happen? Who are the people who are going to really get the process moving? We're dealing with lots of bureaucrats and morons. Who is the group or the person, if we come up with some really consistent white paper, this is the policy, this is the strategy, this is the advantages, disadvantages. Who do you disseminate for? And who's going to read it? Don't tell me a senator or congressman. They read shit. They give it to their staff, who basically is a young kid, just graduated from college, from mostly a liberal college, Harvard or Yale or something like that, who doesn't understand nothing. I wanted to get to the source. Who should we get it to? We know what to do. Where do we send it to, if not the president? And frankly, it depends who the president is. So there's some presidents who are, I'm talking about, very capable of executing on it, and we have access to them. And there are some who will never listen to what you have to say. Neither of them, nor a senator, nor a congressman. Please elaborate.
A national solution is going to require congressional action. So I think that we have to target them as well as those who they represent. I think it's a national educational effort.
Yep.
But I think I'm going to disagree a little bit, Jeanette, and say I think the president, and I think what you said is right. It depends on who the president is. We saw with Obama, he radically changed the entire healthcare landscape
Yep.
with the ACA, which many of us don't really agree with in some ways. So I think it's a multifactorial engagement. But there are three issues that we have to look at. We have to look at access, we have to look at cost, and we have to look at quality. And each one of those has a very deep well that we have to solve. There are ways to solve each of them, both with medical education, and that takes congressional action to increase the number of residency slots. We have to look at cost. We can cut our healthcare costs in half if we can get more efficient across the board and not be so fragmented. That's one of the issues with American healthcare is we're so fragmented. And then quality, we have to elevate, what we've done in the country over and over from the military to the workforce to healthcare is we continue to lower the bar because we feel bad for those who aren't smart enough or aren't talented enough. We need to raise the bar again and make it so that people who are in charge of our healthcare are actually qualified and intelligent enough to take good care of us. So I think it's multifactorial, but it's going to be complicated, but I think it's possible.
Thank you, Omar.
Ziad does not like people who are small-minded and who lack courage and who have a lot of ego. So I don't know how those of us who are not in that category communicate with those who are not in that category who will do something, but there's just something that has to happen. Regulatory capture is what is causing that RMAT category right now, regenerative medicine, advanced technology that has potential cures for cancer, these traumatic, life-changing, catastrophic organ events. They've got the answers there, and they're not going to give the approvals. It's just if it really is a moonshot, you're not going to get it. So fill in the blanks. How do you break that chain between the lobbyists being the same people who are in the FDA, who are the same people in pharma? So that has to happen.
Thank you. Okay, I'd like to leave the floor to the audience. Any questions you have for the panelists? Go ahead, Tim.
Sure. Yeah, what you're saying about artificial intelligence, and I'm trying to relate this to Omar's story, is medical care getting beyond human beings? I mean, you have someone who's looking at your situation. They're not reading all the symptoms. I would think that an AI would get the comprehensive view of your system, of your symptoms. Is looking at those symptoms beyond a human being now? I mean, are we getting to the point where we need AI in order to reinforce it?
No. I think that it's not beyond human beings, but we have to incentivize human beings in a proper way. Right now, the way we're being incentivized is to see more patients, spend less time at the bedside, more time at the computer documenting for billing purposes and billing capture and cost capture. Most healthcare providers in a hospital setting, they hardly spend any time with a patient. We're losing the ability to lay hands on and physically diagnose patients. Many of the physicians coming out of residency now don't know how to examine an abdomen. It's just send them to CT scan. We need to go back to the basics. And I want to tell you a quick story about that too, but right now most providers look at a computer monitor, look at all the laboratory values, they look for the ones in red that are abnormal. They hardly even look at the images, they look at the radiology report, which may be right or wrong, and they treat the report and they treat the numbers that are in red. And we hardly ever, as a group, look at the patient. I used to run a company, I'm ex-special operations, used to run a company called Executive Operations Group, and only hired combat veterans from Delta Force, Navy SEALs, Special Forces, and CIA. Because a lot of good NRA shooters that have only shot paper targets but never been shot at. It's a completely different mindset, you guys get that. We ran a class, it was $10,000 for the week. Everything, tactical shooting, hand-to-hand combat, defensive driving, first aid, et cetera, mindset, situational awareness. And at the end of the week, we opened it to questions. One of the students asked, you guys are all so high speed, how do we get to be, we'll never get there, but how do we get to be a little high speed? And one of my guys who was the senior non-commissioned officer at Delta for about 10 years, said, I'll take that question. And he answered, he said, we're not high speed. We're not any better than you guys, we're the same. What we are is we're the world's best at the basics. Nobody is better than us in the entire world at the very basics. And that's what we need to go back to with healthcare, is the basics, the bedside diagnosticians. That's what I try to train interns and residents. I'm like, what's the difference between you and a nurse practitioner or a physician's assistant? It's that clinical acumen that's, able to lay hands on a belly, and I used to give, and diagnose appendicitis, pancreatitis, or whatever, and we've lost that skill. Physicians coming out today don't know how to do that without a CT scan. So it's still possible, we just have to re-emphasize and we have to incentivize the right things.
I was sharing with Greg in our pre-conference dialogue, having run hospitals for most of my adult life, I've been through a fair number of disasters, fires, tornadoes, floods, hurricanes, situations where entire communities are devastated. The things you see on news that you never want to see, we've been front line on. And I'm going to tell you that the best medical care I've ever seen, the best stories that were life-saving occurred when the computer was down, when we were in disaster mode taking care of the patient, one patient at a time. There's a saying that slow is fast in healthcare. It really is that moment when you're able to connect. So as we become high tech, balancing becoming high touch is crucial. The AI will never replace the doctor or the nurse. You've got to be able to connect there. I think the opportunity really is to remove the noise from the system that's distracting us.
Thank you, Janet.
Yeah, and just to mention, the situation is so dire that it's sucking the talent out of medicine. Sibin, if you could raise your hand, Michelle. These are two nurses who literally are doing things better than the system does. We're talking from medical aesthetics, just making people look beautiful, making more money than the neurosurgeons. You're talking about a nurse that understands how to actually make people better, knows how to harvest tissue, and knows how to actually treat patients. And so these talented people are the ones that you want in front of you.
What I need to say is technology is destroying medicine. So how do we take the technology and still at the same time have the clinicians and the physicians who know the hands-on way to deal with people and then be technology, or who know how to use the technology in addition to their normal way of dealing with patients?
I don't think it's the technology ruining medicine. It's our attention and our focus on inappropriate uses of technology that's ruining medicine. For example, has this benefited us or has it worsened our lives? Both. Most of us, if you walk down the street, are like this, not watching anything, and we're all always on our phones. It's ruining relationships, ruining marriages, ruining parent-child relationships, ruining our sleep and health and everything else. But it's a tremendous asset if we use it correctly, if we limit our use to those functions where it's actually benefiting us. And it's the same thing with technology in healthcare. Tremendous opportunity, and it's not a bad thing. It's our reaction to it that I think is bad.
So how do you change that reaction?
Education and habitual reinforcement.
Can you be more specific?
So, for example, like you were saying, like Jeanette was saying, in a hospital setting, making sure that healthcare providers, physicians and nurses and PAs are spending time at the bedside, engaging with the patient, and making sure that we are not focusing on documentation for the sake of risk management and billing capture, but really focusing on the physician and nurse and patient interaction. And use AI to do some of the documentation, I guess.
You're also saying that medicine has become a business as opposed to an application the individual is to practice with the patient is the center instead of the pocket being the center.
Yeah, but going back old school, there's an old saying, measure what matters. And we've become so metric driven with metrics that have very little to do with benefiting the patient. When you have somebody in an emergency room, and I started out in ER trauma, that's dying right in front of your eyes, and you look up on the screen, and again, you're worried about, did I coach on smoking cessation when they're bleeding to death? It doesn't make sense. But it is a business, Stanford, and you need to realize that we do have the ability to measure what matters on a larger scale and identify those populations that are most at risk for complexity, comorbidity, and ultimately will spend more of the precious healthcare dollars, and then solve for the very things that are causing them to have those comorbidities. So data used right can be very, very helpful in managing populations, managing health, identifying risks. What we do have right now is a calcumi of noise that has reached a screeching level, and it has injected itself, creating chaos in healthcare. It's what you see at the VA when you wait for a year for a primary care appointment. It's what you see at the DMV when you try to get your driver's license. We must have free market solutions that are innovative, entrepreneurial, and faster. And the data we do look at needs to be pooled and harvested for what matters at that time. What matters in the emergency room is not what matters in the labor and delivery suite, and it's not what matters in the primary care office. But we measure everything now because these bureaucrats have gotten themselves quite secure in their jobs by adding new rules every single year. Use our voice. Let's get those rules down to what's essential for patient care.
15 seconds. If you Google numbers of physicians versus administrators since the 1970s, you'll see a graph that shows physician growth that's pretty even, whereas the administrative growth is like huge. It's like 10 times. And where's the expense going in healthcare, and why? It's like government work, right? You have so many people that are there just making up jobs as an excuse to exist. We need to get rid of all that flack and stick to the things that matter, like what you're saying.
So this is from Spinner. So you're a CEO of a hospital. If you are, want to influence your local hospital and your local government, and you want to have a say and an eye on what's happening, what's the best way for an individual who doesn't have deep pockets enough to get on the board to kind of have an influence and have a say?
So the question is, how do you get yourself appointed to a hospital board so that you can be influential? Well, the hospital boards have their bylaws and their charters and a number of seats that are open. So you certainly need to know when the vacancies are, but every public hospital has the ability for people to attend the board meetings and become very active. Also, I would encourage you to reach out to your CEO and ask to be appointed to the board. They will love you because there are not enough people that want to do the good work of being engaged and handling the tough problems. And I can tell you, I've had very large boards and I'm very grateful for them. And in my boards, I have always added as many physicians as the bylaws would allow, because that's what part of the problem in healthcare is that we have so many healthcare CEOs that have no clinical background whatsoever. They're good business people. They're good lawyers, they're good whatever, but they've never taken care of a patient. So having that clinical voice to help you manage the medications, manage the medical care of your population is crucial. And that's gonna help you make better decisions for the community.
So I'm just curious, I've looked at all the hospitals and when all COVID nonsense was, going on, reality was that there's a bureaucracy. Your hospital boards can't do anything. I mean, honest to God. I mean, so much for hospital boards. You've got all of the rigmarole from the insurance companies and from all the government regulations. So where is the core that you go after? I mean, there's a specific problem with the regulations that is dictating all this nonsense. And so what's the path? We need to attack the path.
How do you
Numbers.
How do you cut through all the red tape and all the bullshit?
So I'm going to kind of, and this gentleman wants a question too, but so I'm going to kind of address that. And Greg or Jeanette, if y'all want to address the core, we break free.
Yeah.
I don't think we can fix the system the way it is. It's too complex. It's too ingrained. There are too many special interest groups that are going to resist and not allow it. So we're breaking free. I mean, I've started a practice that is unfortunate. Insurance won't pay for anything, but it's cash-based. But for those people who actually are interested in their health, I mean, we focus on patient-centered healthcare, privatized personalized medicine that will increase health span into triple digits without medications, reverse chronic disease, improve human performance. And I think that's the way of the future. I mean, like regenerative medicine and cellular medicine, the FDA may try to shut it down, but it's going to get out. And people want it, and people are going to get it. So those, unfortunately, I think it's going to be a social strata issue where most people aren't going to be able to afford it, but for those who can, then I think there's another answer, and it's already here.
You go for it.
Yeah, that's true. Break out of the system. We've got a physician here from Canada who flew into Memphis before we came here. Martin has flown all over the world. He's a skier, avid skier, and he's used at least 6 different regenerative technologies to try to get that knee. He's had some really good results, but some of it wasn't enduring. So came to Memphis, and so Martin is very familiar with what's going around the world. He's gone to other countries, Asian countries, to get some of their technology. And if you want to talk to an inside guy that really is smarter than I am, you want to talk to Martin. But yeah, we break free and we engage patients. And I didn't maybe say it earlier. When I said you have to have a relationship with a doctor, I'll just qualify that. What a doctor brings to the table is great. What a nurse that brings to the table might be greater. Sometimes a medical assistant beats both of them, okay? So you want to go to a team with mid-levels, physicians, nurses, and as a team, you break away and you find the right team, and your life will be immeasurably different.
Sir, I'd like to address your question about who is going to do something and most likely going to do it.
Yeah.
Okay? Milton Friedman told us a long time ago that if we're counting on the government to fix this problem, it ain't gonna happen.
Exactly.
Okay? This is an economic issue, in my mind. And the economic issue is that today, employers in this country have built this country. The economic engine has created an enormous amount of wealth, quality, improvement, and what we have today is 160 million people today are insured by America's employers. There is no entity in this country that has more to say about having healthy people, and that is employers. And the issue comes down to is, even though there are hundreds of thousands of employers out there, there's not one single employer that can bring any effect and change. The only way it's going to be done is for these employers to come together and to balance demand and supply and work together to make healthcare and buy healthcare using their collective buying power, okay? And when they do that, they will balance the demand and the supply, and that will help all this stuff we're talking about tonight to come and be true, okay?
Yeah, thank you, but this is utopia. This is fantasy. It's never going to happen. Never. They will not allow this to happen. The system is run like that. You have to eat shit, you have to go through bureaucrats, you have to have an ulcer, you have to go through all that stuff, because this is what the system wants. And if you believe a magic wand, somebody's going to come and do that, no president, no Congress, nobody has the power to do that. We are rotten to the core. Unless something drastic happens, nothing is going to change. It's going to keep on going and going. These are all nice words. They teach them at the stupid college called Harvard or Yale. Oh, idealistic. This is how it has to be. We all have to comply, work together in unison. Unity makes good. This is all bullshit. This is all for public consumption. This is all bullshit. It's not going to happen. Let's be realistic. I'm a businessman. I know that. I know how the system works. You have to break free. You have to get out of the system, create your own bubble, your own world, and do that. Work with people you trust, who are capable, who are performers, to execute. We're not here to change the world. We're not going to save the planet. We are stupid if we think we're going to save the planet and change the world. You have to, hold on, I'm coming. You have to benefit on your own. This is about you. I don't care what the government wants, what my leaders want. It's what about me, my community, we care about. You have to think about you first. They're telling you, don't think about you. We'll take care of you. Don't worry. We're your protectors. That's exactly the opposite. They want to control you, your privacy, run your life, run everything for you. This is all about money, power, and control. You cannot trust them in a million. I'm not like all these poor soldiers who went to war against Iraq and Afghanistan. Thousands of lives, trillions of dollars. What did they get? Nothing. Because they trusted a fucking moron called George W. Bush, who had a vendetta against Saddam Hussein. There was no weapons of mass destruction. It was all wrong intel. We acted on wrong intel. We lost all these great lives and all this money chasing rainbows. All what they tell you right now is rainbows. It's all money, power, and control. The direction it's moving, New World Order, all that stuff, it's all about money, power, and control. You cannot trust them in a million years. Plus the fact they are totally incompetent. They can't manage everything. They want to stay incompetent because by staying incompetent, they make your life miserable and their lives easier. Please, let's stop the utopia. This is utopia. Utopia, I'm not that naive. We're not that naive. This is all manipulation to its extreme. And people are biting on this and believing all this crap. It's all crap. Yes.
I just wanted to.
And of course, Dan also.
Yeah.
And this guy, Tim Kalin, used to work for CIA. So if somebody knows what the fuck is going on, he knows what the fuck is going on. Go ahead.
Well, yeah, I wanted to respond to your comment. Companies that are trying to hire new employees, they're buying the more expensive healthcare packages, the ones that have like the zero deductible. So you've got an inflation there. They're motivated to inflate the system, not to save money on that, because it's a bonus. It's not a cost saving they can get away with. And I'd like to throw that back to the panel. What are you thinking there?
Well, I think I heard two things. I do want to go back to her comment, though, that you can't do anything. I've got to go back there, and then I'll come back to this one really quick. you know, the reality is that you should demand of your community's hospital to go to bat for you, to go to Joint Commission, to go to CMS, to go to DC. And if that's what your hospital CEO in your community is not giving you, then you need to make a change there. Because your CEO should be advocating for you and your community. They're responsible for that 200-mile radius right around your hospital area. And if you're not getting that, then you have the wrong leader. And let me tell you, we have a bunch of wrong leaders that lack a profound amount of.
And most probably it's going to be a long leader. You're going to be an activist. You're going to be a hardcore.
You got to
activist.
be willing to.
You don't believe. You can't lush them. You can't believe them. You can't do anything like that. You have to impose it by force. This is it. Rally people, impose it by force. This is it. The only language these guys understand is force. They don't understand diplomacy. They look at it as weakness. Oh, let's negotiate. There's nothing to negotiate. This is it. This is what we want. This is what we see. This is not, you're not killing, terrorizing anybody. You're just demanding this for the benefit and for the sake of your people. But people have been castrated today. Nobody has any balls. Nobody can do anything. Nobody wants to do anything. It's okay. I want to observe. It's okay. Oh, Ziad, you're too extreme. I'm not extreme. You lost everything. The zest for life, prosperity, happiness, protection, wealth creation. Wake the fuck up. So unless we start doing this, nothing is going to happen. It's very difficult to relinquish power. Once people have power, it's extremely difficult to relinquish power. You only acquire power by more power. You don't acquire power by diplomacy. Or if you are a great manipulator, you can manipulate people's minds and gain power because you're very smart or very powerful. There's no, there's nothing like this. You can't blink, you can't show any defense. Power is dealt by more power. Dan.
So this is really interesting and fascinating what you guys are talking about. And I think the system's broken, definitely,
totally.
As you talked about, Ziad. And so we as a society have a problem here, and that the system's broken. Totally. What I'm hearing is the solution is break out of that thing, get out of that system.
That's what I'm saying.
But yet Omar brought up a very strong part in the beginning saying this system is holding you down, the fear. You can't get out of that because the big guys will take your license away. They will crush you, they will hold you down.
But I agree with you, Dan. I totally agree with you and with what I said. If enough people do that, you start becoming scary. But not enough people are doing that. Everybody's looking at the other. Everybody's looking. Yeah, it's the fear. I mean, look, I see some people, I write extensively blogs, who look at my blogs, so I love your blogs, man. I feel so energized, but I cannot put a like or a comment because my boss will be upset or will fire me. So my response to him, do you need permission to go and pee from your boss? Is this how much we have stooped down? People have been totally brainwashed, castrated, manipulated. The government doesn't have any money. It's your money. They don't have money. You have the money. They work for you. I mean, people need to be instructed again as to how government works, people work, society works. The only way, Dan, you can do that is by breaking their back. Breaking their back is by having a lot of people, doing something about it. Go put a fucking 3 million march. Go to the White House. Terrorize them. I want to do this. I'm not saying go to the Zingo capital. No, it's like this is your demand. This is your rights. I mean, people have lost this. And if you talk like this, I'm going to cancel you. Cancel me. So what? What are you going to do? I don't have any boss. My boss is money. This is it. And every one of us should act like this. Enough is enough. It's been in 2020, and it's getting deeper and deeper and worse and worse. You cannot change the system. You break the system, you go around the system, you manipulate the system. You manipulate the system. Said, how can you talk manipulation? Of course, I'm a capitalist.
Good.
Every capitalist manipulates the system.
Yes, sir.
It doesn't mean that you're doing something illegal.
Yes, sir.
It doesn't mean you do something illegal. You can manipulate the system because you understand how the system works and you use the loopholes and the thing of the system to operate. And that's what you have to do. But people don't do enough homework. They don't do their research. They don't do anything. And they expect somebody's gonna hand them something on a silver platter. It doesn't happen. Nobody's gonna hand you shit on silver platter. Nobody gives a shit, except maybe your parents and your close family, if you live or die. If you don't believe in this, you are delusional. Nobody cares. Everybody's into himself. Me, 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 me. The whole generation, me. Look at my selfie. Look at how beautiful I am. Look at my car. Look at my Lamborghini. Look at my jet. Who gives a shit about this? Success is about empowering people. And this is what we're trying to do in here. We're trying to empower people through these experts' opinions on healthcare, on every asset class. Sorry, I talk too much, but go ahead.
Yeah, so Dan, back to what you said about fear. People are controlled because of their fear of loss. Loss of life, loss of freedom, loss of relationships, loss of economic security, loss of a job. I mean, that's how we are controlled because we don't want to lose. And somebody has, I think it was Tony Robbins, who said fear actually stands for FEAR, false evidence appearing real. So I just want to, building on the story that I told you earlier when I was in the hospital 5 years ago, I was at the very bottom. I mean, just self-pity and emotion. How did this end? How did I end up here? And you know what I found at the bottom of that hole once I realized, I've lost everything? What else do they have to take from me?
You have nothing to lose.
Freedom and peace. Because it was like, what else do they have to take from me? My life? Let them have it. They can't threaten me with anything else. And then you become dangerous. And now I'm at the point, I don't care. I mean, let them take it.
More questions? Yes, Michelle.
Hey, Karen. So, like you said, there's powers and numbers. There are more patients than doctors. A lot of doctors will combat it, exactly what you guys are doing. There's so many that do not believe in regenerative cell therapy. There are no papers on it. They don't believe it. They'll influence their patients not to do it. What are you doing to change that? Are you educating each one of you? Are you educating your patients? How are you educating your patients? How often are you doing it? And are you showing them how to take their power back so that they can regain their health care?
Excellent question, Michelle. Excellent question. Thank you.
The free market solutions, going direct to employer, which is breaking the system, is different. That's the way to go. Free market solutions, getting a cost to employers that they can improve. How are we, that's going to move volume. And money talks. Money's the only thing that talks, right? So we get the cost down, go to employers, that gets the money moving. What are we doing to break the system? My organization, I have the cards in the back. I've started the National Institute for Healthcare Governance. That is the only multidisciplinary, professional healthcare organization that will take on the issues that we've been talking about today and hopefully be able to impact legislation and advocate for our members so that they don't have the ability to do the innovative treatments they're doing taken away, so that we can provide education, so that we can provide legislative advocacy. So there's things that we can do. That's what I'm doing, my contribution, so that these fine, esteemed doctors can do what they do. And I will hand it over to you.
It only takes a spark. So, Sabrina, in answer to your question, what you do is you bring people like you to meetings like this. I'm not telling hardly any stories about what we've already seen, not only in our practice, but we're experts on what's going around the world that will dramatically change the trajectory of somebody's health, sometimes in weeks. Now, it's a both and thing. Omar is the expert on really all the things and the measurements that you to prove that your body is going towards real longevity. But in answer to your question, it's tough to get started. It's tough to get traction. It takes a spark to get the fire going, and you're here. And you guys can talk to Sabrina. She knows exactly how we do our dance. We really want to bring in corporate people who want to bring their whole team to us for healthcare. Individuals who are really looking for something special, but that's how you do it. It's tough, it's slow going, but it's going to blow up.
Look, I'd like to add something here. This is only healthcare we're talking. but also we deal with every asset class. Real estate, private equity, blockchain, technology, oil and gas, etc. We have an event on November 9 on oil and gas and renewable energy. Same issues, same thing we're going to be dealing. So the goal is to bring in people who are experts in their field. We don't want people to just a member. I want commitment, time commitment, brain power, activism, whatever asset class it is. You're an expert in real estate, you're an expert in healthcare, you join the silo. Today you have a silo of 3 experts in healthcare. Hopefully we're going to have 6, 9, 10, 12, same thing in every other sector. So when you bring in this brain power together and this collective activism together, you're making a difference. You're writing blogs, you're doing podcasts, you're writing op-eds, you're writing this. This is not anymore one individual writing an op-ed in the Wall Street Journal. This has no impact. This is a bunch of 50, 60, 100 people doing that. You're going to create a lot of noise. And when people are going to create a lot of noise, people are going to read this and say, you know what we're planning to do in July 4? I'll tell you, you want noise? I'll show you what noise is. I am the expert of noise. July 4, 2010 was the formation of the FBC. We created the organization, Independence Day, July 4, 2010. Next July 4, 2024, we're planning a 1-page ad in the Wall Street Journal. It's going to cost a couple of $100,000. 1-page ad. The Bible of Finance, Financial Policy Council, preserving the legacy of the Founding Fathers. If you look at the Constitution, it was signed by 56 Founding Fathers. This ad is going to be signed by 56 of us, board members and Project Liberty team members. This is going to be a bomb, a nuclear bomb. People are going to read this, Financial Policy Council, preserving the legacy of the Founding Fathers. No activist organization, no conservative organization did or will do anything like that. This is noise, and good noise. So we are basically following the legacy of the Founding Fathers and signing up on this ad. This is the kind of stuff that gets lots of attention, that has a lot of substance. This is not style, this is substance. It requires people who are committed, who are ready, willing, and able to sign this ad. If you're not, you don't have what it takes. If you're too afraid, because your name is going to be there on the ad on the Wall Street Journal, you're not up our standards. It takes commitment. Listen, we're not doing anything wrong or illegal or anything. We're doing stuff that's right to do and that we believe in. So if people are going to blame you that, why are you doing this? There's nothing wrong. The Marxists, the leftists are extreme left. We are here coming on that part. We're a conservative organization. This is what we believe in. Enough this hiding, this shadow thing, this fear. Enough. Nothing is going to happen if you keep on like this. It's going to get worse and worse. Because what they see, listen, first they take your hand, then your arm, then your leg, then your whole body, then they have totally got you. You cannot move anymore. So you have to push back. This is how all liberations happen. Look, I'm not even born here. I came here as a legal immigrant. I love this country. I am shocked that I'm fighting for this country more than people who were born and raised here 3-4 generations. They became blasé. They became nonchalant. It's okay. As long as I have my beer and my Netflix and my things, I'm fine. I have no power, I have no money, I have no authority, I have nothing. This is how most people are. We have to wake them up. I honestly believe in this. I'm not seeking power, I'm not seeking office, I'm not seeking nothing. This is the essence. And if we don't do it, we're going nowhere. We're going only down. And your kids and your grandkids are going absolutely nowhere at the rate things are going. So healthcare is one cog of the whole thing. It's extremely important. It's the most important asset class. That's for sure. Because without health, you're done. You have nothing. No most important. I'm not comparing it to others. But also, it evolves on other things too. it's health, it's prosperity, it's everything. So any more questions? I'll take one or two more questions and that's it. I really hope this is going to wake you up, all of you. We are at the crossroads of something very dangerous. And if we have the left coming to power again in 2024, I can assure you this country is finished. It's finished. You better, I don't know what I'm going to do. This country's finished. 4 more years of this? I mean, come on. And it's not personal hatred or animosity. It's policies. It's policies. There's not one policy that benefits the people or the American citizens. From immigration to taxes to regulation to you name it. Check every box. I mean, look, I'm a Christian Catholic, okay? I don't want to get into religion, but let me tell you my opinion. When I was very young, I was born and raised as a Christian, everything. But I was always had a critical thinking, critical mind. Why am I Christian? Why am I not Jewish or Muslim? Why? This is a great story you're going to really enjoy. And I went to Bar Mitzvah when I was young to some Jewish friends of mine. I said, I love the Bar Mitzvah. I went and told my dad, why am I not having a Bar Mitzvah? He told me, you're not Jewish. You cannot have a Bar Mitzvah. So I'm telling you, I was this critical thinking. So I told him, okay, fine. Although I love this Bar Mitzvah shit. So I went and read everything. The Bible twice, the Old Testament, the Quran. I speak Arabic fluently. And then I realized, I said, I have to make a choice. I can't be like this, It took me like 4 or 5 years to read all of them twice. By the age of 18, I said, I'm Christian and I'm going to remain Christian. And I'll tell you the reasons. And I said it to my priest in the congregation, parishioner. He was shocked. I thought, let me tell you something. I decided to remain Christian and I want to be Christian, not because Jesus Christ was reborn, not because he was resuscitated, not because he did all the miracles, not because any of that. He told me, what happened to you, son? What do you mean? This is all facts. This is what Jesus Christ did. I told him, no, doesn't impress me. He told me, so what does impress you? He told me, this is a guy who was born 2,000 years ago. He had no army. He had no money. There was no TV. There's no media. There was nothing this guy had. 2,000 years later, we still talk about him. This is a guy who, by his own personality and deeds, empowering others, love each others, empowered people to still believe in him. I don't think a lot of people did it because of the miracles he did, but because of the impact he had for 2,000 years. What I'm trying to say, you can have the same impact, each one of us, if they have the commitment and they believe in something and they're willing to die for something. I'm not Martin Luther King. I'm not doing speeches like this. But this is very important. You cannot imagine the power you have as an individual. And today the governments, not just the United States, around the world, they're trying to strip this power because they want you under their control. So the more you fight this, the more you believe in this. And if you feel weakness, go and network with like-minded people who will lift you up. Then you wake the fuck up and do it. This is maybe the most important speech you will hear, believe me, because no organization will tell you this because they don't give a fuck. I do. We do. Anyway, closing remarks from each one of our panelists, great, brilliant panelists, and then we close the event.
Well, I just want to, no one maybe got the joke of my doing the little hum. This is a trained opera physician on the other end of the table, so I had to do something crazy like that. Listen, it's been a pleasure to be in front of you guys. I am not a money magic guy. understands a lot of, I'm a front lines clinician who cares about what's going on to my country, who cares about taking care of patients, who's ashamed what's really happened to medicine and maybe how I didn't start speaking out sooner. But that's over. It's like Omar said, and like Jeanette said, and like Ziad said, we no longer can accept small-mindedness, a lack of courage. We are ready to make changes.
Thank you so much, Greg. Jeanette.
I just want to say thank you to you, Ziad, and to Stanford and the FPC for hosting this. And I want to say thank you to each of you that came today, because you're working. It's a lot. Some of you've traveled here to be with us. But I want you to know what Omar said, that we really are on a dawn of something truly amazing if we have the courage to speak. One person can make a difference. We can make a difference. You can make a difference. So it's a good fight. And only through the freedom that our country gives us and through free market solutions are we going to live our best life possible. I'm telling you, wearing all gray in the government line isn't it. So please come with us on this journey. I love hearing about all the innovation from the crowd as you asked your questions. And that's exactly what we need more of, because our country was engineered to be built on a free market economy. I want to see more of that.
Thank you so much, Jeanette.
And it's up to each one of us to take personal responsibility for our own health and our own welfare, and to take responsibility for one another. I mean, it's all about community at the same time. The government's not the answer. It never will be. So
it's a problem.
Yep, it's up to each one of us to stand up and not be silent and not be fearful.
Thank you so much.
And the future's bright.
Thank you so much.